Hello, my name is Mark Starr. I'm a medical doctor, and today I'm going to tell you proper treatment of hypothyroidism and some of its ramifications. When I finish this presentation, I'm sure you'll have lots of questions. Most of them can be answered by the statement, when medical treatments do not make sense, the answer is always dollars and cents. The first cure for hypothyroidism was in 1891. They used glandular or desiccated thyroid from animals. Pigs, sheep, and beef thyroid glands worked the best, but they decided on the pig thyroid because pigs are the closest genetically related to people. Eventually they decided that. They didn't know that in the late 1800s. But by 1915, this is a picture of before and after treatment with the glandular thyroid. This is not a diet. The puffiness, it's called myxedema. That's the medical term for hypothyroidism. Mix means mucin, which is a normal constituent of the connective tissue, and it accumulates in abnormal amounts in over half the patients who have hypothyroidism. And so you can see how puffy this fellow is, and it oftentimes accumulates along the jaw lines. The hair is not so good, and the neck is often swollen. So you can see after treatment quite a profound change. This is another example from the same article in 1915. This doctor was the first of 4 generations now of endocrinologists in Belgium. I send all of my European referrals to this doctor's clinic in Belgium, Dr. Hertog. It's his great-granddaughter. Her name is Therese Hertog in Belgium now. You can see quite a difference in the physiology. A young lady, age 14, the bridge of her nose had not yet developed. The endocrinologist called it saddle nose. Her lips were puffy. She was mentally dull. She had very heavy menses, severe constipation, poor appetite, all symptoms of low thyroid. So after just 6 months, you can see what a profound change, and most of her symptoms had resolved. By the way, this textbook, Dr. Lisser was president of the American Endocrine Society. It was published in 1957, and this is the last medical textbook about hypothyroidism that I could find in 6 years of research that had before treatment and after treatment pictures. It was republished in 1962. The same pictures were in the second publication. So ever since that time, we've begun using synthetic thyroid, and I'll tell you more about that in my book. So how do you diagnose yourself with low thyroid? Because not everybody's puffy. You can check your temperature under your armpit when you first wake up in the morning. The temperatures are here on the PowerPoint slide. 97.8 to 98.2 is normal. Rectal temperatures are slightly higher. The Celsius readings are here as well that are normal. Women who menstruate have to do it during the menstrual cycle, days 2 through 4. So the treatment I recommend, the first thing you do is test to see if you have autoimmune thyroid problems. It's called Hashimoto's, because if you do have autoimmune thyroid problems, it means you have to take synthetic thyroid. It's called T4 or levothyroxine, and T3 or liothyronine. And you take a combination of those two if you do have Hashimoto's. If you do not, then you can take the old-fashioned desiccated glandular thyroid that's made from pigs. And I wouldn't recommend patients try treating themselves. They can do it with over-the-counter products, but the more powerful stuff, the prescription strength, you really need someone who knows what they're doing, because it's getting harder and harder to treat patients these days. We are full of toxins and allergies and poor diet and you name it, and it's all the electromagnetic stuff that impairs our health as well. So I would recommend seeing a physician who knows what they're doing. This was a study by the 3rd generation Hertog. Since about the 1960s, and especially since the 1970s, the doctors have been taught to use something called levothyroxine, which is only one part of the glandular thyroid, Glandular thyroid has T4, T3, T2, and T1, and levothyroxine is T4. They saw patients, this is the third generation endocrinologist in Belgium and two of his colleagues who came into their study. These were the symptoms. So the number one symptom was fatigue and weakness. When they switched patients from the synthetic T4 to the old-fashioned glandular and waited about 2 years, the incidence of fatigue went from 90% down to, I think, 34%. I have a hard time reading that. Cold intolerance is one of the many symptoms. It went from 86% to 23%. Rheumatoid means joint and muscle pain. I'm a pain specialist. 2/3, 77% down to 28%, just by treating thyroid properly. People wonder how come I'm a pain doctor and I use hormones. Well, here's why. The other constipation down here is a common symptom. It decreased quite a bit. Headaches and migraines down from 55% to 15%. So the vast majority of headaches and migraines resolve. Muscle cramps is a common symptom of low thyroid, 56%. This is a more detailed description of the study. So the dosages used in the study are down here. So months of treatment, 23. Natural desiccated thyroid is the bottom line. So 200 milligrams, which is just about 3 grains in the patients who came in who had not been on the T4 or the levothyroxine. And then over here, after 26 months, it takes about 2 years for the thyroid to have all of its effect. And after 26 months, the average dose for the people whose thyroid gland had failed, that's how come they were on the levothyroxine or T4, needed more. They had 233 milligrams to restore themselves to their health. So you'll have to read my ebook in order to find out much more. And I also have a book dedicated solely to the treatment of hypothyroidism. So if you're a physician, I would recommend purchasing that book first.